Welcome dear viewers to the video on topic strength dependent dissolution specification for oral formulations. So this topic may be new to many of the viewers. We are aware about the dissolution. We are aware about the dissolution specifications. We are aware about the oral formulations. But we are generally not known to this topic of strength dependent dissolution testing, dissolution parameters, dissolution conditions, and the specifications. This video will help you to understand in depth regarding all the points for strength dependent dissolution specification. Oral formulations are like tablets, capsules. These formulations may be formulated into immediate release, modified release, delayed release, prolonged release, and many other types. Also, the oral formulations include oral suspensions for which dissolution testing is performed. The medications are available in different strengths as per the indication and the disease condition, as per the patient requirement, and as per the safety and toxicity profile of the molecule. All these formulations are required to be tested for dissolution testing. Dissolution testing is a in vitro test to understand the product behavior in vivo. Same molecule can be formulated into different formulations and also in different strains. For example, if you consider metformin is available in 1000 mg dose, 850 mg dose, 750 mg dose, 500 mg dose, and it is also available in IR and extended release or modified release type of formulation. Similarly, if you see paracetamol, it is available in different formulations. It is available in different strengths and with the different release profile. As the regulatory requirement is there that the dissolution specifications are required to be product specific, and these are also required to be strength specific. These are required to be having the discriminatory power. So it becomes necessary to understand between the dissolution specification which are strength dependent. Different strengths behave differently in the dissolution testing and have different release profiles. For example, if you want to perform dissolution of 1000 mg tablet of, let's say, metformin, it will have some release profile. Similarly, when you perform the dissolution of metformin tablet of 500 mg, it will have little bit faster profile than the 1000 mg dose, because dissolution is affected by the strength of the formulation, and that's why the dissolution specifications are strength dependent, and this is the main topic for the present video. I request you to be till the end of this video. Watch this video till end so that you will understand all the information regarding this topic. Many more video I will make on this topic, and this will come in a series. So dissolution testing is for ensuring the consistent drug release across the different strains. Dissolution is directly affects, or dissolution profile directly affects the in vivo behavior, and it is linked with the safety and efficacy. So the dissolution specifications for oral formulations should be consistent. So, starting with the introduction, why are strength dependent dissolution specifications critical for oral formulations? This is the question. Understanding how different strength of the same drug formulation require different specific criteria, dissolution specific criteria to ensure consistent bioavailability. What are strength dependent dissolution specifications? Dissolution criteria set for different strength or strengths of an oral drug to ensure consistent drug release and the therapeutic efficacy. Different strengths may behave differently in terms of dissolution due to factors like drug load, excipients, and the tablet size. See here, the dissolution profile differs from one strength to other strength. Generally, the lower strengths are having the higher or faster dissolution compared to the its higher strength, and that is because there is a different drug load, different amount of excipients, there is a increased or higher size, there is difference in the shape, and also along with this that affects higher drug load affects the sink conditions. We are going to see those things in detail in the upcoming video slides. For this slide, consider that different strengths have different release rates or dissolution rates. Dissolution testing measures how the drug releases into the body from dosage form. And dissolution testing purpose is to ensure that the drug releases at right rate and extent for therapeutic effect, impacting bioavailability and therapeutic efficacy. So you cannot say that if higher strength is having some release profile and lower strength is having faster profile or matching profile to the higher strength, then consider the patient requirement. Consider the rate and extent of its therapeutic effect and consider its side effect. Generally, faster dissolution may provide the faster rate of absorption. It will increase the Cmax in less time, or it will have higher Cmax at particular time. The formulations with faster release profile may give rise to faster onset of action because of the faster absorption, and also sometimes it may lead to some side effects. So the dissolution rate affects Cmax, Tmax, and EUC, and that's why it impacts bioavailability and the therapeutic efficacy along with the side effects. Now the question is why strength dependent dissolution specification matters. So whenever you are working with different strengths of the same molecule, to ensure the dissolution consistency, strength dependent specifications are required. And these specifications guarantee that all strength of the drug release, all strength of the drug product release the drug at correct rate. Supports bioequivalence. It is important for generic drugs to demonstrate that they perform similarly to the reference product across all strengths. Manufacturing flexibility accommodates changes in the formulation or manufacturing without affecting therapeutic outcomes. So this is the reason why strength dependent specification matters. So what are the factors affecting the dissolution across strengths? One of the important thing is drug load. Higher strength will have higher amount of API, that is high drug load. Lower strengths, middle strengths will be having lower amount of API in the formulation compared to the highest strength, and this will impact the dissolution rate. Generally, higher strength will have specific release profile, and compared to that higher strength, the lower strength may have or generally have faster release. So this is because of the drug load. Then excipient variability. Changes in the excipient compositions between the strengths can influence the dissolution. So if I am using some surfactants or some solubilizing agents or some stabilizers in the formulation, so different strength will have different concentration or level of excipients. Then tablet size and surface area. So it is not only for the tablet size, it is also for the capsule size. Number of pellets if the capsule is pellet filled. So larger tablets, larger capsules or more number of pellets in the higher strength may dissolve differently than the smaller tablets or or less number of pellets. The impact of drug load on dissolution. Higher strength may have different dissolution dynamics due to the increased amount of API. Example, a 100 mg tablet may release the drug more slowly than 10 mg tablet depending on the surface area and the excipient formulation. So if you consider the 100 mg tablet and 10 mg tablet of less soluble API, you can see that there is a much difference between the two strengths. 100 mg has some specific profile, while 10 mg is much faster compared to the 100 mg dose. This is because of the change in the tablet size, change in the drug load, or not change, you can say difference in the drug load, difference in the tablet size, different in the excipient composition, difference in the sink conditions. If you perform the dissolution of 100 mg tablet and 10 mg tablet with the same dissolution conditions like 900 ml of media, 50 rpm, then you can see that the 100 mg tablet is slower compared to 10 mg tablet dissolution rate. And it is very obvious because it will take some time to dissolve 100 mg while the 10 mg will get dissolved at a faster rate. Modified dissolution methods for different strengths. So as I have mentioned earlier, if you go for the similar dissolution conditions, you will have different release rates based on different strengths. So now coming to the dissolution medium, larger tablets may need a higher volume of dissolution medium. Apparatus variations. Different dissolution apparatus or methods may be used for different strengths to ensure proper dissolution. Method validation. Methods must be validated for each strength to reflect the correct release profile. So here understand that if you are performing dissolution of 100 mg strength and the 10 mg strength in 900 ml of media, if you want to match the dissolution of 10 mg to 100 mg, then you will need more amount of media or higher stirring rate, otherwise it will not match. Sometimes sink condition differences will be there because of the drug load in the different strengths. So, how to tackle the sink condition problem? Generally, multi-unit dissolution is performed, and I am going to make a separate video on this topic and in the upcoming time. But for now, consider the dissolution medium, apparatus variations, and method validation. Strength dependent dissolution for a hypothetical drug. So just example I am giving you here. Higher strength have slightly broader dissolution limits to account for larger drug load and the tablet size. Three strengths are there: 10 mg, 50 mg and 100 mg. 10 mg provides a dissolution rate or release, and for which you can give 80% dissolution in 30 minutes. That is 80Q 30 minutes. Consider it is a IR product, immediate release formulation. For 50 mg you cannot achieve 85% dissolution, so 80% dissolution is considered and 75% Q limit can be given in 30 minutes. And if you go beyond 70% Q dissolution in 30 minutes can be given as a specification. So here you can see the drug release is getting slower, or the dissolution specification limits are less compared to the 10 mg. For 10 mg it is 80Q, for 50 mg it is 75Q, for 100 mg it is 70Q. Different products behave differently. Different specifications can be given to different formulations. This slide is just for your easy understanding, and it is a hypothetical type of situation. Regulatory requirements for strength dependent dissolution. So the regulatory bodies like FDA, EMA and other guidelines provides the regulations. Regulators require that each strength of the drug meet appropriate dissolution specification for bioequivalence. You cannot give the same specification across all the strengths. It will be very difficult to prove the discriminatory power and also IVIVC for bioequivalence. Considering the bioequivalence, the same dissolution characteristics for all strengths are essential to ensure the generic product is therapeutically equivalent to the reference product. And this is very critical when you go for biowaiver. Now, what are the benefits of strength dependent dissolution specifications? Consistent product performance. It ensures all strengths performed predictably across batches. Regulatory compliance meets the bioequivalence requirements for different strengths. Reduce clinical study requirements. Reduces the need for clinical studies when formulation changes occur. So it will support you for the SUPEC changes as well. How dissolution profile support bioequivalence? Dissolution profile of the test product, that is generic, must match to that of reference product across the strengths. Bioequivalence studies. Regulatory agencies require dissolution profile that match the reference products to confirm therapeutic equivalence. So this is the main point, how dissolution profile support bioequivalence. Now coming to the what are the challenges in setting strength dependent specifications. First is formulation complexity, second is manufacturing variability, third is clinical impact. Formulation complexity like variation in the excipient composition and drug load can complicate dissolution testing. Sometimes we go with the common blend approach for different strengths, or we go with the scale up scale down formula. Example like 100 mg tablet weight, 100 mg is the strength and tablet weight is, let's say, 200 mg. It is having other strength 50 mg with the tablet weight of 100 mg. So the tablet weight is proportional and it will have great impact onto the dissolution profile, release rate, or percent dissolved at particular time point. If the product is lookalike type of formulation, like 50 mg is having a tablet weight of 200 mg, also 25 mg is having a tablet weight of 200 mg, so it is a lookalike type of formulation. So in this type of formulation complexity, it becomes difficult to have strength dependent specification. Another one is manufacturing variability. So like differences in the manufacturing conditions can affect dissolution, requiring precise and flexible specification. Clinical impact, ensuring that variations in a dissolution across strength do not impact clinical outcomes. So this one is the challenge, that how to prove that there is no clinical impact though the release profile are different. Coming to the IVIVC. IVIVC is a link between the in vitro dissolution profiles and the in vivo drug absorption. Strength dependent testing ensures that dissolution rate or dissolution behavior across the strengths correspond to expected therapeutic effects in the body. Strength dependent dissolution specifications are essential for ensuring that all strengths of an oral drug formulation release the API consistently and predictably, achieve bioequivalence, consistent therapeutic outcomes, and meet regulatory requirements for generic drugs. So this is very important that strength dependent testing should be performed. Strength dependence, strength dependence of the formulation to be evaluated in detail. So I hope this is a new topic and you might have got idea about this topic. Let's meet you soon with the other informative video in this strain dependent dissolution series. Thank you for watching the video, and I hope this video will help you to understand the strain dependent dissolution specifications, what is strain dependent dissolution conditions and parameters. Thank you for watching the video.